This is how to administer an intramuscular injection using the Z-Track method. To begin, I'm going to check my PCP orders and gather my supplies. For this procedure, I will need gloves, alcohol preps, a syringe, 2 needles, medication, patient labels, trash container, and a sharps container. I will begin by checking my orders, obtaining my medication, and checking the expiration date on my medication. I will begin by swabbing the top of my vial with an alcohol prep to cleanse, and I will open my syringe. I'm going to open my needle and attach to my syringe. I am now going to withdraw my medication. I will withdraw 1 ml of medication today. I am pulling my plunger back to the 1 ml, marking on the syringe. Holding my vial, I will insert my needle, inject my air, and then invert my vial and withdraw my medication. Next, I will passively recap by scooping my cap and using the sides of the cap, recap my needle. It is necessary to label your syringe. I will have a patient's label which will include the medication, the dose, and the route. And I will label the syringe before I take it into the patient's room. When giving a medication using the Z-Track method, it is necessary to change the needle after withdrawing the medication from the vial, as the needle is now coated with the medication. I will remove my needle, place in the sharps container, and place a new needle on my syringe. I will enter my patient's room, wash my hands, introduce myself to my patient. I want to identify my patient by asking them to state their name and date of birth as I am looking at their identification bracelet. I also want to ask my patient if they have any allergies. I'm going to put my gloves on. I will use my alcohol prep to cleanse my site. The preferred site for administering an IM injection using the Z-Track method is the vastus lateralis. As I'm cleansing my site and assessing the skin, I want to make sure that my injection site is free of any bruising, infection, wounds, scarring. I'm allowing the alcohol to dry on the skin. I'm not going to fan or blow on the site. At this point, I'm going to remove my cap and discard in the trash. I'm going to hold my syringe in my right hand like a dart. It's my dominant hand. With my non-dominant hand, I will place on the patient's skin and displace the skin approximately 1/2 inch. My angle for injection for an IM injection is always 90 degrees, and I will dart my injection straight in. At this point, my non-dominant hand will hold my syringe, and my right hand will aspirate the syringe to check for blood. At this point, I will inject my medication into my patient, going at a rate of 10 seconds per 1 ml. At this point, I need to allow the count to 10 and allow the medication to disperse. And with my non-dominant hand holding the syringe, I will withdraw the syringe. Next, I will dispose immediately of my sharps in my sharps container. It is not necessary to rub the injection site. You may dab with a sterile gauze if there is a little bit of blood. You will want to come back within 1 to 2 hours to assess the injection site for redness and irritation.